My diagnosis was really interesting. I had no symptoms at all. If I wasn't doing that 2-yearly mammogram at 74, I would not have had it picked up. I'm a fairly let's get on with it person, so I took that attitude. I thought, well, I'm not going to be able to change it, but it was a shock. And my biggest concern was worrying about everybody else, because I've always been the strong one in the family when it was me that actually needed carrying at that time. The expert clinical trial was fascinating. I came back for my post-surgical results. He said, I'll share with you about this research trial, and gave me all the information, talked me through it, beautiful explanation of everything, what it involved, how it got picked, who did what, and that you could pull out at any time, that you could still go and see an oncologist and get another opinion. So before I'd even got out to my car parked out the back, I'd decided I was going to trust the science. So agreeing to go on the trial, it's been a positive experience. Peace of mind, because it was having all that extra histology being done. The 3 monthly follow-ups. Jenny, the research nurse, is very supportive, and just somewhere else you can go if you need information or can talk to. I thought if I was randomised after all this extra testing as low risk, didn't I owe it to other over 70-year-old women to participate in the trial if it was going to help decide in the future whether women of any age needed to go through radiotherapy and the potential side effects of it. Medicine and science only evolve, don't they, because people research and we see it on a daily basis around the world. From when I did nursing in the 60s or training to what the nurses do now and some of the treatments now. I mean, it was a given 40 years ago if you had radiotherapy treatment that you were going to be really unwell. And clearly, even over the 5 or 10 years of this trial, things will change. So if this research can change or guide the further treatment of women with breast cancer, well, it's a no-brainer in my view. It's just a no-brainer.